perpetuate the inequities that are silencing and literally killing our Latino communities and other people of color. And that is why I introduced the Health Equity and Accountability Act. And it's a tri-caucus bill that comes at a time when COVID-19 painfully exposes the existing and persisting health inequities in communities of color. HEAA builds on the gains made by the ACA, recognizes the historical factors shaping inequities, and seeks affordable and quality health care for all. What we believe we'll learn from this pandemic is that we need to change our healthcare system. But most importantly, it will ensure that if we face another public health emergency, we will be better prepared to protect our communities. I'm fighting hard and working with my colleagues in the Congressional Hispanic Caucus and the Progressive Caucus to include measures that our communities need in future aid packages. More must be done in the coming weeks, and Congress must act swiftly with urgency to ensure all families receive the assistance that they need and deserve. I'm off to read what the bill looks like, and of course to advance any potential amendments that can help improve it as we go back to DC next Thursday and Friday and continue to respond to this pandemic. Thank you so much for the invitation to join you today.
Thank you so much, Congressman. We appreciate you, and we thank you for all the hard work that you and your colleagues in the House are doing. Thank you so much.
Thank you so much.
Hi, I'm back. I'm sorry.
Welcome back, Myra. Look, we're in the world of technology, and you have.
I know this is the first time that happens, but I'm very sad because Congressman Chuy García is my hometown congressman, and I just want to thank him for all the work that he's doing. And when we talk about the importance of having leaders who look like us at the table, I mean, Congressman Chuy García is a great example. He, alongside his colleagues from the Congressional Hispanic Caucus, have been pushing to make sure that our undocumented brothers and sisters are getting some type of relief in the next coming stimulus package. So thank you, Congressman. Apologies for my technical difficulties. Now my cell phone low, so let's hope this works.
You're back.
Well, thank you, Congressman.
Thank you.
Great. And I believe now we were going to introduce our panelists.
Yep, that's right.
Great. Great, perfect. Sorry, y'all, I'm on a cell phone, so I can't see everyone, but I see Dr. Rios is on, so I assume that everyone else is on. Thank you all for bearing with me. For those of you that didn't know, and not that this is a reason why my internet failed, but it's very, I think, telling that so much of the work that we're doing right now is digital. And a recent study showed that over a third of Latino families don't have access to Wi-Fi or broadband internet in their homes. And so I can only imagine the ordeal and the struggles that our communities are facing to do, virtual and digital education for students to access information. And this is why this panel is critically important. Again, thank you, Healthcare Voter, for convening us all. Some of the data points that I wanted to share before my internet rudely cut me off is that Latinos make up 18% of the population, but we are over a quarter of COVID-related deaths in this country. And that figure is stark, and it should be alarming and worrisome for all of us. Moreover, 84% of Latinos have reported that they cannot work from home, and that's more than any other group that has been surveyed. 49% of Latinos have experienced job losses or cuts. 50% of Latinos say that they have $500 or less in savings. And, today Dr. Rios will share a little more about this, but, we are predisposed to have, diseases that make us more vulnerable to coronavirus, such as diabetes. And so all of these inequities that have already existed and have afflicted the Latino community are only exacerbated by coronavirus. And so I'm very humbled to be able to share in this conversation. And to start us off, I want to quickly introduce everyone. So today we have Dr. Elena Rios, who is the president and CEO of the National Hispanic Medical Association. Thank you, Dr. Rios, for all of the work that you and your colleagues are doing on the front line to protect us. We have Stephen Lopez, who is the Director of Health Policy at Unidos US, and Danny Friedman, the Managing Director at Voto Latino. And to kick us off, thank you all for all the work that your respective organizations, that you as individuals are doing to raise awareness of the impact of coronavirus in our communities. And before we really delve into some of the systemic impacts of coronavirus on our community, I wanted to ask you all first, how has COVID-19 personally impacted you, if at all? So let's start off with Dr. Rios.
Oh, well, you know, I think here in Washington, D.C., we have had as many cases and deaths as everybody else. So I'm happy to say that I've been home working remotely and with all my staff, and we have figured out how to use Zoom, and we have figured out how to have more remote meetings than ever before, but we're fine at this point.
Great. And how do you feel like it's affected some of your colleagues that are on the front lines?
Well, that's a different story, and I'm going to talk about a little bit about that through the hour, but I think the most important thing to know is that the National Hispanic Medical Association was started by a group of Latino doctors. I came from California. We have doctors from New York, Chicago, Miami, Los Angeles, you know, San Antonio, the Valley. We've got doctors all over the country that were very, very interested to start an organization that could give solutions and strategies from the front lines. And let me tell you that everybody's working hard and trying to do what they can to help their patients and their families. But I do know of, especially the private practices, you know, all the dental practices had to close down. Private practices lost most of their income. The community health centers are down at least 30–40% of their patients. And even surgeons, if you can believe it, surgeons are not working because they can't do elective surgeries. So there's been a lot of impact among doctors and dentists and nurses that have lost jobs or are decreasing their income just like everybody else because of the focus on the most needed healthcare issues like the intensive care and the ventilators and the emergency rooms. Those have been, you know, skyrocketing in terms of workloads.
Great. Stephen, let's go with you. How has COVID-19 impacted you in your personal capacity?
Sure. Well, first, good afternoon, everyone. Stephen Lopez with Unidos US. For those who may not be familiar with Unidos US, let me just say a quick bit for context purposes. You may have noticed by our former name, the National Council of La Raza, or NCLR. And while our name has changed, who we are and our mission has not. Now over 50 years old, we remain the nation's largest Latino civil rights and advocacy organization, working to increase opportunities for the nation's nearly 60 million Latinos. We do this through a combination of expert research and advocacy programs, along with our network of nearly 300 community-based affiliated organizations in 37 states, DC and Puerto Rico. And collectively, we seek to challenge the social, economic, and political structures to ensure we create a more equitable community and country for us all. You know, I think about, you know, the privilege that I have, right, of being able to work from home, feeling relatively safe and secure. Although, you know, my head and heart are not far from home, my family back in the Central Valley in California. I think about my niece who shows up at the grocery store every day for her job, family members who are providing healthcare in a variety of settings. My brother, who's an elementary school teacher and is showing up every day to ensure that his kids have the education that they need. And so certainly grateful for the privileges that I have, mindful, right, that I'm incredibly fortunate. And that's why I think for all of us, right, why we continue this fight to ensure that all of us have the safety, healthcare, and really sort of the basic elements that we all deserve. And so it's a pleasure to be here, and thank you for inviting Unidos US to participate today.
Of course, thank you, Stephen, and thank you for bringing it home, because I know so many of us, while we have the privilege to work from home, as you mentioned, have family members that don't. And my mother is a caretaker. She works with senior citizens, and it is frightening to think that she can easily be affected by COVID-19 and bring that home to my father, who was supposed to have elective surgery right as this pandemic hit us, and it's been postponed. And so those things, even though they might not personally affect us, are definitely such common stories in our families. So thank you for bringing that to light. Danny, how has COVID-19 affected you?
Yeah, well, thanks, Maida, and Healthcare Voter for having me be a part of this conversation. My dad is actually a family doctor. He retired a few years ago, and now he exclusively works at a free clinic that caters to the undocumented community. And they were able to switch to telemedicine, and the kind of treatment that they provide is usually lower risk medical care. Folks need to go to the emergency room or something like that with COVID. Is still seeing folks with other health issues. But that was an immediate change in my family. And of course, we had the ability to transition to working from home, and that's what I've been up to. But it's been a real challenge to see the way that the country is coping with this. Voto Latino Week, our primary mission is to civically engage young people, Latinos, age 35 and under. And the feedback that we've been getting from those folks as this has gone on has been incredible. The concerns about family members, the concerns about how the different government packages may not reach their families, either because they're mixed status or for other reasons. And our Latino community is really on the line with this issue, and I'm just pleased to have the opportunity to join this conversation.
Great, thank you so much, Danny, and we'll definitely delve a little more into how young Latinx community and voters are feeling and engaging because of this. Dr. Rios, let's go back to you, and you started mentioning how this is affecting your colleagues. A study showed that Latinos are infected at a rate almost 3 times higher than their white counterparts. In New York, for instance, that's the epicenter of this pandemic here in this country. COVID-19 is killing Latinos at twice the rate it's killing our white counterparts. Why is it that Latinos are among the racial groups that are seeing some of the worst outcomes in COVID infections and deaths?
Well, the Latinos, as you said, have been 3 times as many cases as the white people in our country. As the congressman mentioned, it really has to do with the poor living conditions that we see our communities living in. And this has been going on for years. What we call social determinants of health include having crowded housing, poor housing, limited education, limited English proficiency. We carry our language, and especially for our elderly. We live in crime areas, high crime areas with toxic stress, which means that we have a lot more mental issues to deal with, living check to check. Our families are working more than 1 job, 2 jobs, and because of the low income jobs that they work in, that's even more stress. So our bodies are made to, not to deal with stress very well, basically, and we end up having less fruits and vegetables that are good for us, and we end up having obesity, lots of nutrition issues that lead to diabetes and cancers and heart disease, especially high blood pressure. And we see these issues, these diseases happening in our families for young adults in their 20s. We're also seeing, by the time you're in your 40s, you're already losing your kidney function and going on dialysis. Our families are really devastated by the living conditions in this country that people really don't pay attention to. We also have children who are getting sick. And I know that we now know about the pediatric multisystem inflammatory syndrome that is hitting babies and infants and more than ever before. And right now with COVID, the COVID-19, which is the coronary virus disease of 2019, it is hitting all age groups. And in fact, the CDC shows the age groups of the young adults, 18 to 44, about a third, the 45 to 64, a third, and 65 and over, a third. But what happens is the younger you are, the more you can fight off the virus. So you end up, having the ability to survive and be resilient. But the older you are, with having diseases for more than 20, 30 years, diabetes, heart disease, cancers, you end up, dying for those especially who have respiratory problems like asthma or other COPD and problems with your lungs. So anyway, I'll just stop there. But it's just been very devastating for our communities.
Great. And I want to just put it out there, and we can come back to this in a second, but you should in that our bodies are just not meant to deal with all of this toxic stress and trauma. And so I'm going to pivot to Stephen, but want to put it out there for the panelists, because I'm sure many folks watching right now are grappling, if they're not themselves on the front lines, or grappling with the stress and trauma of having family members, of just merely like surviving in this moment. And so I'd love for you all to share, what are some ways to cope? What are some ways for Latinos in particular to preserve our mental health when, we know that mental health is so taboo or talking about is so taboo in our community. So I'm going to give you a time to think about it, but I wanted to pivot to Stephen while we're on this thread of Latinos being disproportionately affected by inequities in our healthcare system. And Stephen, Unidos has been, at the front lines of making sure that there's policy that centers our communities. And so one particular policy you have been working on, the Health Equity and Accountability Act, provides policymakers with remedies that seek to eliminate long-standing health disparities, which are obviously magnified by this pandemic. What are examples of how this legislation could provide immediate relief to Latinos affected by COVID-19?
Sure. Unidos US have been proud to partner with Representative García and the Congressional Tri-Caucus, that's the Hispanic Caucus, the Black Caucus, and the Asian American Caucus, this Congress, to introduce the Health Equity and Accountability Act. It's a piece of legislation that has been introduced for a number of Congresses. It's long been relevant. I think in this moment, it's even more relevant, and the idea is even more urgent to put into practice. I'll give you a few examples of the immediate relief that provisions in the Health Equity Act could bring. One, it would expand health insurance to everyone, regardless of status. Dr. Rios articulated the number of challenges that our community faces to be healthy. Latinos remain one of the most uninsured communities in the country. Roughly around 19% of our community insured compared to about 5% of non-Hispanic whites. And the Affordable Care Act was a game changer for our community, but unfortunately about 10 million of us remain uninsured. So there's work to do to close gaps in the uninsured rate. And this is a moment in time where everyone should have comprehensive, accessible, and affordable health coverage to get the testing and the treatment that they need, and also to preventative measures as well. So expanding access to health insurance for everyone, removing participation barriers in our safety nets, especially for mixed status families, right? So we know that lawfully residing immigrants still have to face a 5-year waiting period to be eligible for Medicaid and the Children's Health Insurance Program. Lawfully present adults maintain a 5-year bar with respect to nutrition aid, like the Supplemental Nutrition Assistance Program. HIA would eliminate those bars. It also makes needed investments in culturally responsive and linguistically appropriate healthcare. which again has always been important, but in this moment in time, especially so. And then needed strengthening of data collection and reporting. You know, this narrative around Black and Brown communities being disproportionately harmed, the data are showing that this is the case, right? In parts across the country. And we need more attention focused on collecting, analyzing, and reporting data so that we are able to target the necessary interventions, but also the case making and the federal and state level for the needed resources for our communities that have been disproportionately harmed. So again, you know, I know he's no longer on the call, but I do want to make sure to highlight Representative Garcia's leadership. Again, where Unidos US has been a proud partner with him. And these are, again, immediate, pragmatic solutions that, if put in place today, could not only bring relief for our communities, but our country overall would benefit from this. We like to think that this is an opportunity to write a new book for, you know, in the event of a future pandemic or public health crisis, centering the needs and experiences of our communities that have long faced inequities is, again, a solution that can benefit us as well as the entire country.
Great. Stephen, I love that you use that metaphor, writing a new book, because I do think that in the midst of all of this darkness and helplessness, we have been really provided an opportunity to rethink about these systems that have historically not centered our communities, have not centered the needs of Latinos. And so I think that you are absolutely spot on in how do we take a step back and use this opportunity to recalibrate. And in that recalibration, Danny, I know that you mentioned that your dad works with the immigrant community. One, what are you hearing in terms of the lack of resources that we're providing, or our government is rather not providing our immigrant brothers and sisters? What are the struggles that they're facing? And then two, in that vein of recalibration, where are the opportunities that you see either for organizations like Voto Latino or just our community overall to really, you know, take advantage of this moment and begin centering the voices of those who are often left out of the conversation?
Yeah. Well, when everything started to change in March and folks started to adjust their work processes, we saw a government leader starting to take a different tack in terms of warning folks, creating guidance, ultimately the various emergency declarations and the movements from Congress. One of the first things that we saw folks engaging on was the first support package, essentially the CARES Act and the different, I guess that was the second one, but the CARES Act, which was the first one that impacted folks, real folks in the world as opposed to other entities. And of course, that was the legislation that introduced the financial support for individuals impacted by COVID indirectly, right? The stimulus checks. And the amount of interest and curiosity from our online audience was very high. And we got an extraordinary amount of comments and follow-on questions from folks who said, I'm a DACA recipient, will I receive support? I'm an American citizen, but my parents are not and we live together. Will we get a check? And there was a lot of curiosity and a lot of concern because, as other folks in the conversation have brought up, right? Latinx folks are on the front line, right? Essential workers, whether it's picking food or processing food or in the healthcare industry or at the grocery store or whatever, right? We've got folks who are continuing to be in the workplace and being put at risk or losing their jobs, losing hours, having their opportunities reduced. And so the interest there is really high. One of the things that we've seen change in the movement, of course, also is that, as we continue to engage folks with their with civic engagement and inspire them to their opportunity to get registered and vote, participate by voting, participate by taking the census. Many of these activities involve people seeing each other in public places in real life, right? The person outside of the grocery store, or at the farmer's market, or going through the neighborhoods canvassing to take the census or get folks registered. And that kind of activity has essentially stopped. Voto Latino, we're a digital first organization. So we've been engaging folks online primarily for all of our existence. And the things that happened as a result of COVID is that some of our partnerships that we've done with local groups that would have involved in-person activities changed to digital opportunities. So our distributed and online organizing efforts are in full swing, where folks can, go on our website and sign up to volunteer. And of course, people can still register by going to votolatino.org. But there's more to do. We've reoriented a little bit of our work to engage in advocacy. So right now we've been fighting for a couple of different things as we've been seeing this issue come up. One, we were excited to see some paid sick opportunities come out of the First CARES Act, but we're promoting paid sick leave for everybody. If you work and you're sick, you should be able to stay home and recover and stay safe, right? If now more than ever, the case for that is clear. And so we're supporting efforts for universal paid sick leave for workers. The other is, of course, the CARES Act included support for implementation of safety measures for COVID for folks to participate in primaries and general elections. It was $400 million. It's not enough. And given the scale and the scope of this pandemic, and we think that people should be able to vote early in a safe manner, right? Because we know that Latinos are more likely to vote in person than by mail, but also to support universal vote by mail in order to create a safe opportunity for folks to participate in that sacred franchise. So we're mobilizing people on that issue right now. We're gonna have a big mobilization next week. So, come to votolatino.org, and we're doing this in concert with many organizations to help give some backup to people like Congressman Garcia, who are supporting all of these different safety measures for folks.
Great. And next week it's the May 18th, correct?
Correct. It's May 18th. Yes.
So
That's
one of
right.
the great ways for those of you watching, for you to plug in if you want to help advocate on the expansion of voting rights, May 18th, a coalition of organizations are working on that. I want to pivot back. And let's go with Stephen and then Dr. Rios. For folks watching, as I mentioned, many of us are antsy. We want to be helpful. We want to be productive, but we also want to take care of ourselves. So Stephen, back to Danny's point about like ways to plug in opportunities, what are some of the things that folks can do now, either working with Unidos US to make sure that they're funneling that energy into something tangible? And then secondly, if you don't mind sharing, what are your best practices on how you're taking care of yourself?
So the first thought around folks taking action now. A few hours ago, the House introduced or released its HEROES Act, which would be sort of the next iteration, right, of the CARES packages. We continue to look at economic assistance for our community, nutrition aid, healthcare as priorities, because while there has been good progress has been made, we know that it has fallen short to fully addressing the needs of our community. So there's still advocacy that I would ask folks to either start doing or continue doing to ensure that lawmakers are hearing from folks across the country, right? That no one should be left behind, that everyone should have, again, those basic elements to maintain their safety and economic security moving forward. So it's calling your member of Congress, your senator, doing what we can to apply pressure to our policymakers and to support the efforts of our champions in Congress, like the Congressional Hispanic Caucus, as an example. So that's one. I think to Danny's point, November is so important for our community that we need to make sure our voice and our vote are as loud as possible in this election. And so, you know, folks are eligible to vote, and if you're registered, to be ready to cast an informed ballot come November. To your second point, I probably need to do a better job at this in terms of my own self-care. But I think staying in touch with my family, I call my parents or text on a daily basis and FaceTime as much as possible. But I think, you know, there's such power in our community. Our roots run deep and strong. And I think it's moments like this where familia, however you wanna define that, right, for yourself, we're staying connected with familia in some way. I think, again, just sort of fuels the fight, especially for moments like this, where we're all showing up, right, in this moment for our community and for our country.
Thank you, Stephen. And I appreciate the honesty and vulnerability. I think many folks, you know, we all need to do better, but I think just, you know, talking about it and calling it out is important. So Dr. Rios, what can we be doing to take care of ourselves and really combat some of this toxic trauma that we carry that only makes us more vulnerable to COVID-19?
There's so much we can do. I think the most important thing is to really think more positively. It's hard to do with all the activities happening right now. But I think that, you know, there is a light at the end of the tunnel. We have to be a little bit less stressed out day to day. And I think it really helps to get sleep and to exercise. And I think taking walks outside is really important. And I know we all have to think about social distancing and wearing a mask. And that's to help protect ourselves, as well as especially those who have a cough and don't know if they're really with the COVID-19 until they get a test, if they can get a test. But I think it is important to follow those social distancing rules and just know that we're going to be living like this for at least another year and a half until we have a vaccine. We're not going to see the big crowds of concerts and conferences and all the big meetings that families, celebrations have been used to in our communities. We're going to have to figure out a way to stay in touch, especially with our elders, our grandparents, our parents, who they're the ones that are going to be the most isolated. They say as the country reopens little by little, the youth, especially our young people, are going to say, hey, I'm invincible. I'm going to go out and party, you know, just like they always do. And they won't think much about continuing to communicate with their grandparents. And I think that's something that we need to figure out how to get the message out to our communities. And I just want to say that our doctors with the National Hispanic Medical Association, we also network with nurses and dentists, public health officials. This is a time, I think, when people are realizing how important healthcare personnel and healthcare workers are, and that workers at all levels, whether they're community health workers, promotoras, or whether they're people that have gone to college or, got out of high school and became a lab tech or a X-ray tech, or, you know, they draw blood, they're messengers in our hospitals, or they went to college and became a nurse, or stayed, you know, like me, 20 years in school or whatever, 10 years in school and became a doctor. But all of us and all of these Latinos are very, very few. We only have 5% of all the doctors in the country that are Latino, and only 3% dentists. And so they are incredibly stressed with those, especially on the front lines. And our advocacy, and I have to say, we do advocacy. We work with Unidos US and Congressman García on the HEA task force or steering committee. We've been working one-on-one with different congressional offices. And I have to say that we've been able to get lots of ideas from our doctors and dentists and nurses on the front lines to translate into some policies. And one of the biggest ones was to have the data collection, because if they don't count us, then nobody knows how bad off we are. And the other thing is we've been pushing for the immigrant doctors and the immigrant nurses who are in this country are called foreign doctors and foreign nurses. Some of them are United States Americans that just happen to go to medical school in Guadalajara, you know, and come back. But anyway, they have a horrible time getting to work here. So I know Congressman Cardenas is pushing for a bill to actually use green cards that people didn't even use. There are green cards just sitting there. So anyway, we're hoping that more IMGs can actually help our communities because they are Spanish speaking. They are coming from countries of either the Caribbean medical schools, Puerto Rico, I'm sorry, but Mexican, and very, very interested in helping our communities.
Thank you. And I mean, you said it best, representation matters in every facet of society. For those of you that have questions, since my internet is down, I apologize, so I'm not seeing them. So if folks from Health Voter Project can put them in the chat and I will navigate them from my cell phone because I know we are down to our last 15 minutes and I want to make sure that we are engaging all of you and all of your brilliant questions. And I will segue to say that one of the things that we've seen at Latino Victory is that there was a lot of hopelessness when this pandemic first started hitting, and a lot of misinformation, you know, folks in our community not knowing, you know, what to believe when, you know, the head of our country is making light of the situation. That translates to Spanish media and folks not really understanding how seriously they should take this pandemic. And one of the things that Latino Victory started doing is we began highlighting all of the work, the amazing work that our Latino leaders are doing all across the country, our elected officials. And so for those of you interested, every day on our Twitter, Latino Victory US, and on our Instagram, we post what folks in Arizona are doing, what folks in Florida are doing, what folks in New Mexico and Texas are doing, all the way to our like Soul Latino in Kansas. We have a Latina mayor who is a mayor of Topeka, Kansas, the first Latina mayor of Topeka, Kansas, and all of the work that she's been doing to center our community in combating the virus, but also putting out information. And one of the things that I saw that it's been the most helpful is when elected officials use their own platform to just put out resources. Mayor in Tucson, Arizona, Regina Romero, started. Did I freeze again? Can you all hear me? Mayor in Tucson, Arizona, started. Technology is not my friend today, everyone.
So I just wanted to quickly, if folks can hear me, just quickly jump in, you know, to Myra's point. You know, I mentioned our network of affiliates. There, you know, so many of our community-based organizations have stepped up even more than they already have to really fulfill essential services for our communities, whether that's providing healthcare, ensuring that families are getting fed, and other supports. And so, you know, that despite sort of this dark sort of period that we're in, that also gives me hope, because I think our communities are mobilizing. I think, you know, our communities understand our power and are doing what they can, as much as they can, again, to meet this moment for our community and for our country. And I'm just going to do a shameless plug that this evening at 7 p.m. Eastern Standard Time, Unidos US is hosting a town hall with Latino mayors from California and Arizona, talk about what's been the local response, local electeds meeting the needs of our community. And so you can go to unidosUS.org for more information, or follow us at We Are Unidos US. But just wanted to share that as another resource.
Thank you. And sorry, technology is not my friend. I apologize. Today has not been a very technologically savvy day, but thank you, Stephen. And yeah, Dr. Rios, were you going to talk about the things that give you hope?
I was just going to say that you know, it's very important to have representation. And we also are very concerned about having more health workers for the future generation. We do a lot of mentoring. We have internships, but also in terms of advocacy, we understand the very, very limited number of Latinos in any leadership position in health, especially public health, the public health departments. And I have to put out a shout out for one of our doctors, our fellow, Oxiris Barbeau, is a New York City Health Commissioner. We have another friend, another doctor who we've given an award to we have a scholarship program with scholarships to students, Latino students interested in healthcare careers. And one of our awardee this last year was Barbara Ferrer. Dr. Barbara Ferrer is the Los Angeles Public Health Commissioner. And we're very proud of the very few Latinos that we can get to see at leadership positions, but we really need, and this is part of the problem of why our programs are not as culturally responsive in Medicaid and Medicare and CHIP. We have to get more leaders in public health at all levels, as well as more hospitals and clinics, medical schools, nursing schools. We need leaders that can change the curriculums and the programs for our communities, for our safety net, for the poorest in our communities, the farm workers in the US-Mexico border, Puerto Rico. We're just very, very limited in the decision making that we have. So I just wanted to say that. And we are having a webinar also. We're calling them the NHMA virtual briefing series. We're starting on a monthly basis, starting May 28th. And that'll be on our website. For more information, it's nhmamd.org. And we're going to focus on what are the impacts of health and healthcare on our community, working with doctors who are in private practice or in clinics who are taking care of the poorest people in our communities.
Thank you. And I just want to thank Dr. Rios. She is so humble, but she is a phenomenal medical professional, and not only a medical professional, but a medical advocate and a founder. She founded this organization, is at the helm of it, and has been constantly trailblazing a path to make sure that our communities' voices are centered in the healthcare conversation. So thank you. We stand on the shoulders of the path that you have trailblazed, and you know, everyone on this call would not be here without the work that you're doing. So thank you so much for all of the work that you have done and that you will continue to do. Your voice is so critical.
Thank you. Well, thank everybody here is important for moving the agendas forward.
And also, in the plug of Representation Matters, we have one Latino member of Congress who is a doctor, Dr. Raul Ruiz. And we need more folks with a medical background to step up and run for not necessarily Congress, but we need folks at all levels of government. We need you to run for school boards so that you integrate the curriculum. We need you to run for office at the local level. Again, representation and diversity of perspectives is so critical to making sure that we address this issue holistically. So thank you again, Dr. Rios. And Danny, what are you hopeful for? 32 million eligible Latino voters. How is COVID gonna make sure that we recognize the importance of our elected leadership?
Yeah, I mean, one of the things that makes me hopeful is that, you know, sort of despite everything that's happened, there's still enthusiasm about getting out to, right? We've seen, even with some of the elections that have happened since COVID has occurred, right? We've seen record participation this year with Latinos in the primaries and caucuses. We're really excited to see that energy translate, you know, throughout the year. You know, our mission, right? We love to register voters online. We were doing it before COVID. We're still doing it. Our goal is to register 500,000 new voters this year for this election cycle and turn out voters. So we're gonna keep working on it. We're gonna keep working our Latinx community to get that done. But I mean, if there was ever a case that you know, to be engaged and to, you know, take a look at the consequences of our elected leaders and how they play out in our real lives, right? If there was ever a time, this is the time to see that and experience that. And you know, we're excited about the engagement and the interest of folks to make a change.
Thank you. And I just want to close up by uplifting some of the things that you all said. One, Danny, that point about the importance of our elected leaders. If COVID-19 has one silver lining, it's that we recognize firsthand the impacts of government. You know, whether or not you believe in government, whether or not you believe in politics or partake in politics, every decision made at a gubernatorial level affects our daily lives, and no other instance in recent memory has exemplified that as this moment we're living in. Two, representation matters in all facets of society. So your voice, if you're listening, your voice is so critical. We all have platforms. We have our families, we are in WhatsApp groups, we're on Twitter, we're on Facebook. Right now, as Danny pointed out, that we can't meet in person and we can't engage, reach out to your family members, reach out to your friends. One, take care of each other, make sure that everyone's okay. But two, let's not forget what's at hand in November, 170 something days, where we have an important task ahead of us. And so make sure that you're talking to folks and reaching out and taking care of one another. And three, to Stephen's point, which I think was so beautifully articulated, you know, we are at a moment in time where we have the opportunity to rewrite the book, to center the voices of those often left behind, to make sure that when we're talking about essential workers, when we're talking about living wages, when we're talking about paid family leave, that we're thinking about the folks whose lives were on the line, and make sure that our daily life, that our conveniences were still fulfilled. Our grocery workers, our farm workers, our meat packing industry workers, our caretakers, folks that are often not regarded with the respect and with the admiration for the work that they do. It's an opportunity to center those voices. So I want to thank all of you, one, for being part of this conversation, for convening with me, and two, for dealing with my technological issues. Again, I want to just point out, a third of Latinos across the country don't have access to Wi-Fi or broadband internet in their homes, and cannot partake in conversations like this. So it's important that you're using your platform, reaching out, and making sure that you stay engaged. I do want to close out by sharing some important information about Healthcare Voter. As we mentioned, representation matters. So if you have a story, if you want to share your story, please share your story. Go online to healthcarevoter.org/story. You have instructions on how to submit your stories. Secondly, on Thursday, May 14th at 3 p.m. Eastern, Healthcare Voter will hold another virtual town hall, this time focusing on our Asian American and Pacific Islander brothers and sisters. Happy AAPI History Month. And the challenges that they're facing during this pandemic. If you'd like more information, again, go to the website, ourlivesontheline.org, and RSVP. And immediately following this town hall, you're welcome to join for a town hall debrief at healthcarevoter.org/debrief to continue this conversation and speak with other members about Healthcare Voter Initiative and how to get involved. Again, healthcarevoter.org/debrief. Or you can find the link in the live stream post description. We have a lot of work ahead of us, but the thing that gives me hope is seeing so many folks in our community step up and be there for one another. So thank you for all of the work that the three of you are doing. Thank you for everyone watching. Please take care of one another. If this pandemic has shown us anything, it's the power of the people, the power of the community. And so we look forward to continue to build with you, to coalesce and to really organize our community, because our voices matter. And now more than ever, that is on the line. So thank you all so much. We appreciate it. Bye.